This week, the sugar tax, introduced by the government in the last budget, came into effect. This sees a rise in prices on drinks containing more than 5 grams of sugar per 100 millilitres. Any drinks with 5 to 8 grams of sugar will be taxed at 20 cents per litre, and drinks with over 8 grams of sugar will be taxed at 30 cents per litre. The tax has been brought in as a measure to deal with the increase in obesity, particularly amongst children. The Department of Finance, Public Expenditure and Reform estimates it will raise €40 million in a full year from the tax. But does it really work, or is it just another way to tax working people? The beverage industry claims the tax won't reduce obesity, but proponents of the tax claim that it will reduce consumption and force the industry to make changes. In Mexico, which introduced a sugary drinks tax in 2014, consumption of sugary drinks subject to the tax reduced, but only marginally, and the figures are somewhat disputed. A similar pattern can be found in other countries such as France. There is no evidence that taxing sugary drinks have reduced obesity. Data from the NCD-RISC project shows no reduction in obesity levels in the countries where such a tax has been introduced. Those who support the tax claim that it is already having an effect, with drinks companies reducing the amount of sugar in their drinks to avoid the tax. In some drinks, the sugar is being replaced by artificial sweeteners. If the sugary drinks tax hasn't been proven to improve obesity levels or reduce consumption, what other options could be explored to stem the crisis? According to UK firm Ebiquity, soft drinks companies spent £37.8 million on advertising in 2016 in the UK. A ban on advertising would be a good start. In Quebec, where a ban on advertising fast food to children has been in effect for over 30 years, a recent study has shown a reduction in calorie intake from fast food. The city has the lowest obesity rate in children in Canada. Another option could be a direct tax on the producers of sugary drinks. Coca-Cola Ireland made €11.3 million in profits in 2016. An additional tax could raise money for the state to use to provide healthcare and promote healthier choices. The sugar tax is unlikely to improve rising obesity levels in Ireland. Once again, ordinary people are paying the price, whilst profit-making corporations continue to promote their products that are causing harm.